Welcome back to Doctoring Differently. Today we're talking veteran disability exams. I've gotten so many questions from doctors who are looking for utilization management or forensic medicine options outside of full-time clinical medicine. It is July now. I discovered and started performing veteran disability exams in January of this year. So just 7 months ago. It was not something I thought I could do as a pediatrician, thought I capped at 18 years old. But the thing with veteran disability exams is that they're not diagnostic, they're not treatment oriented, they are effectively forensic exams. So I began seeing veterans as old as 87 is the oldest I've seen so far. And I've really enjoyed it as a general pediatrician who hasn't had a adult patient in close to 10 years at this point. I have really enjoyed my experience speaking and talking with veterans. I'm in Southern California, so there are a lot of naval and Marine bases here, some Air Force bases, but there's a lot of veterans and armed forces bases, military bases in especially California, Texas, and Florida, but honestly throughout the country. So I am still so grateful that this opportunity discovered me, I discovered it, because it has been a great option. I'm all about options for doctors. It's been a great option to stay here in town and to really make a lucrative income, side income, full income, depending on who you are and how much time you want to commit to it. These exams are guaranteed to our veterans who've served our country. In the GI Bill, they are entitled to these exams as soon as they exit the military, and a civilian doctor has to perform them. It can't be an active military doctor. So these are exams that are very needed and necessary to serve our veterans. And I feel like so many physicians have no idea about it. I did not know, and I especially didn't know a pediatrician could do it. So any physician from any specialty in any state with any state license can see veterans in any state. As long as you have an unrestricted medical license in your state. I'm in California. I could go to Arkansas, Massachusetts, Washington. I could go anywhere to see veterans. So this is a highly lucrative opportunity. I will share more about it. I'll do another video kind of really going into the ins and outs of what these exams look like. They don't take long. They're not a huge time commitment. Even within the day, it doesn't take longer. To see a full day of veterans for me has never taken longer than 6 hours. But I've really enjoyed these experiences these past few months. I'll continue to do it and kind of pick it up and put it down as my schedule allows, but it certainly has opened my mind and my world to more history. I'm learning about the Korean War, the Vietnam War, and I'm also just talking to service men and women as young as late teens, as old as I mentioned 87, which has been so rewarding and fulfilling for me. Really makes me grateful to live in this great country, but also grateful that I have the skills to be able to kind of go in and out of different types of medicine, that I'm not restricted to just clinic or just the hospital at any time. I could travel to different states through the Veteran Affairs system, the Veterans Administration, and see veterans, which is a really positive thing, again, that I did not know that I could do for so long. But now that I do, I hope you, as a physician or clinical practitioner out there, I hope that you can take my experience and learn something and maybe find out about it too. So thanks for watching. Subscribe, like, all the things. Ask me questions if you have any. Thanks for watching. Have a good one.